There's a recent study that shows that about 70 million Nigerians are undiagnosed with hypertension. That's approximately 1 in 3 to 4 adults.
What's the population of Nigeria?
Approximately 270 million.
So you mean that 70 million behind are undiagnosed of hypertension?
Exactly. It's such an irony for a very popular condition being a silent killer.
Exactly.
Hello, guys. Welcome to Med Corner, a captivating podcast dedicated to exploring the vast and ever-evolving world of health and medicine. I'm Dr. Habila Oxburg, and I'm here with my very good colleague, Dr. Yahweh. And today we are going to be talking about the silent killer, the silent assassin, hypertension. Dr. Yahweh, why is hypertension popularly known as the silent killer?
Hypertension is known as a silent killer because of how it presents majorly. Now, most times the disease grows very slowly, and then by the time the person is aware that he or she has the disease, it's already presenting with some complications. It's also one disease that can affect every single important organ in the body, from the head to the toe of an individual. It's also implicated as a major risk factor for stroke, myocardial infarctions, what people call a heart attack, and even chronic kidney disease. So it's really, really sad that the awareness for it is not as much as it should also be. And then the acceptance of this disease is also very low. I'll talk about this later on. So by all this, you see that it's really a silent killer. And by the time people really, really want to do something about it, it's almost far gone.
And it's such an irony for a very popular condition being a silent killer.
Exactly. Because
and there's a recent study that shows that about 70 million Nigerians are undiagnosed with hypertension.
That's large.
And 30 million
How
people.
many? How what's the population of Nigeria?
Approximately 270 million, I think.
So you mean that 70 million behind are like the number of people undiagnosed of hypertension?
Exactly.
That's really
that's approximately 1 in 3 to 4 adults with hypertension.
Wow. So it means if we count randomly 4 people, there's a tendency that one of them is living with hypertension.
And it's previously that people used to think hypertension was something of just elderly people or aged people, but with the way the environment is and how our diets are changing, lots of young people have been coming down with hypertension.
Exactly. And I agree with you because, I mean, even in the clinics, the outpatient clinics that we run, we see a lot of young people less than 40. That's by young, that's what I mean. See a lot of people less than 40, sometimes even less than 30-year-old individuals, both male and females, coming down with hypertension. And you're wondering what's happening. Yeah, I think we should, just for clarity purposes, should define what we mean by hypertension. So hypertension simply means elevated blood pressure. For some people who are familiar with checking their blood pressures, there are usually 2 values. There's usually one on top and one below. The one on top is called systolic, and then the one below is called diastolic. So the normal blood pressure should be less than 120/80.
That's
so that's
optimal. Perfect.
Yes, perfect. So the one up, that's systolic value, 120. The one down, less than 80. So it should be less than 120 over less than 80. However, between 120 to 130, 80 to 90, the American Heart Association still sees it's elevated. However, the European classification still classifies it as normal. Yes, but for clarity purposes and then for everything to be in synchrony, they all agree that anything more than 140/90 is hypertension. Yes, and then these values is not just a one-time value, it should be consistent. Maybe you've gotten 2-3 values at home of this elevated blood pressure, and then we term that hypertension. And then you definitely need some, an individual definitely needs some interventions. Yeah, so generally we divide hypertension into two. Yes, can you just talk about that?
Okay, we have what we call the primary hypertension, and then there's the secondary hypertension. So the primary hypertension, there's no known cause really. It's just associated risk factors that points towards the primary hypertension, while the secondary hypertension, usually there's something ongoing in the body that is causing the blood pressure to be elevated.
Okay, so I think we should explore a bit on those risk factors. Now, by risk factors, again, risk factors are just things, they are factors. They may be lifestyles, they may be different facts that by their mere presence increases the chance of somebody coming down with hypertension. So that's just what risk factors are. They are predispositions, they are factors, they are tendencies, they are situations, circumstances, generally, that by their presence, they increase the chance of somebody coming down with hypertension. Exactly. And then in medicine, we divide risk factors generally into two, the modifiable and the non-modifiable risk factors. So which one should we start with?
I'll start with the modifiable ones.
Modifiable ones.
Yeah.
Okay. Yeah, so modifiable risk factors, as the name implies, modifiable. You can modify them.
Work on,
you can do something about it. Yeah, so that's where you have that's where
obesity,
you have obesity,
diet,
like smoking.
Alcohol.
Yeah, so habits of people generally. You find them under modifiable risk factors. So the obesity, you can exercise, the diet, whatever you're eating, you can do something about it. We'll explore.
People who live like sedentary lifestyles a lot, office jobs, they're always sitting down, no exercise and stuff.
Exactly. So obesity on its own increases the chance of somebody coming down with high blood pressure, with hypertension. So I think that would be another topic to start saying who is obese. These days there are a lot of body positivity people, and you say, okay, I'm not obese. I'm
obese. I'm horizontally challenged.
It's not even horizontally challenged. Okay, I'm chubby.
I'm thick.
I'm thick. I'm a thick. I'm in the thick zone, or I'm a thick babe, and all that. No offense. Respectfully speaking, some of those things are things that would increase someone's chance of coming down with hypertension. Once you do, you know your height, you know your weight. The formula for the BMI, body mass index, the weight over height square.
Yes,
right?
Weight in kilograms.
Weight in kilograms over height square. Yeah. So anything more than 25. Is it?
I think it's about 24.9.
Yes, anything more than 24.9, anything from 25 going on, that's already overweight. Anything more than 30, that's obesity. So I am challenging everyone to just pick a pen, you know your weight, you know your height, just calculate this so that you know where you fall into. So apart from obesity, we talked about what people eat. People eat a lot of fatty foods these days, and
a lot of people eat a lot of salt. Like whatever you cook, you just have to put extra salt.
Yeah.
And salt is taken for granted, but it plays a major role in bringing people down with hypertension.
Exactly. If you're in that category, that whenever they cook food, you went to a restaurant and then they bring you, say, hello, do you have extra spice or salt? And then you want to spray on your food. Please stop that. Any salt that is not added in food, why it is still under heat, should not be added at all. And even the ones you add under heat should be in moderate quantities. Those additional salts can increase people's chances of coming down with hypertension.
Thank you for clearing that out. Yeah. Just imagine someone putting a lot of salt and then saying it's okay as long as it's on fire.
Exactly. It's very important to clarify some of these things because people can just take information and run with it and fly with it without getting like what we really mean to say. I was talking about fatty foods, and this is also one of the reasons why we find a lot of young people coming down with hypertension these days. The kind of food we eat these days, a lot of food is processed, a lot of food is fast. Everybody wants to eat the pastries, the shawarmas, the meat pie, burgers, and all that. So all this, I'm not demarketing anybody's business, but all these are some of those things that will increase people's chances of coming down with hypertension. Smoking, we cannot stop talking about this.
That, yeah.
Yes, we cannot stop talking about it. There's no single benefits of smoking. Alcohol too, we advocate people should cut down on their alcohol. If possible, if you have not started, don't start. If you're drinking, please cut it down. Very, 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 very
There's
low.
this statement I know a while back that if God meant for man to be smoking, he would have built a chimney on our head.
I really need to think about it. Okay, so God doesn't mean for us to smoke. I don't know if I shared this story. I met somebody some time ago, and he was, in his defense to why smoking is very good, he says, he asked me, I was very much younger, he asked me that, what's our skin made up of? What's our skin made up of? I'm asking you.
Asking?
Yes.
Made up of a lot of things.
No, okay, I'm not trying to ask you for the medical. What was our body created from? What did God create our bodies from?
From sand, dust.
Clay, yes. Clay, right?
Yeah.
And so if you want to make clay very strong, what would you do?
I'll dry it.
Or you heat it. Why you not getting You're saying, the people that mold things, by the time they mold it and you want to make it strong, they pass it through heat.
Yeah.
So he's trying to say by smoking, he's heating up his body and making himself very strong. That's on the side. So, but really, there's no benefit of smoking, and that can also increase chances of coming down with hypertension.
Do you want to talk about the secondary causes? Secondary hypertension.
Okay,
right?
yes. The secondary hypertension, just as he mentioned earlier, the ones that there are causes. Primarily, there's really no single thing I can point to and say, okay, this is what is causing this. The genetic predisposition and then those risk factors increase the chance together. But for secondary, you can say, okay, this is what is causing this hypertension.
And if you can take care of what is causing it, then the hypertension resolves.
Exactly. Once you can attend to the issue, the underlying problem, the hypertension resolves. So for secondary, you have issues like endocrine problems. Endocrine means hormones. So there are some hormones in the body that once they are in excess quantity, they can cause hypertension. And then some
kidney diseases.
Yes, kidney diseases, exactly. One thing about kidney disease is that it's like a vicious cycle. Hypertension can cause kidney disease.
And
kidney disease can cause hypertension.
Exactly.
So in a situation where you have the two, they keep on making each other worse. So
a toxic relationship.
Exactly. So that's one cause of secondary hypertension. You have I've talked about endocrine, some vascular issues. Some people have issues with their blood vessels. Those can increase. Those can cause hypertension. Neurological issues,
drugs
some tumors, drugs, very important. And this is another common reason why hypertension is presenting in younger people these days. You see 20-year-olds, 25-year-olds, 30-year-olds coming down with hypertension. You're wondering, my father did not have this thing. My mother didn't have this. So where is this coming from? Drugs, guys. Drugs. Cocaine. Very, very implicated. These days, in the past, when you say cocaine, you say, people cannot afford it here. It's not our thing. It's not a Nigerian thing. Cocaine is very, very much with us.
Is it affordable now?
I don't know if it's affordable, but people are doing anything to get it. Yes, they are doing anything to get it, and a lot of people are taking.
All it takes is the first take.
The first take,
hit, yeah.
Yes, and then they sell properties, do anything, they work to get it. And cocaine can cause hypertension. Apart from cocaine, you have drugs like marijuana, even drugs as simple as paracetamol. In large quantities, those people that misuse those things. So it's not just the commonly misused drugs, even the over-the-counter drugs in large quantities can predispose or even push someone into those issues. So lifestyle modification, very, very important. People should do what's right. For the genetic aspect, not so much you can do. You cannot do anything about the fact that your grandfather had hypertension or your mother had it. So
But the fact that someone in your family had it doesn't mean you should go ahead and do the other things that bring those risk factors. Because for the fact that there's someone in the family that has it doesn't mean that you particularly would have it. I mean, you could do all the management things we are going to talk about to be able to prevent it, such as the exercise, watching your diet, and
so I think we should just explore on that too. So exercise is very important.
What kind of exercises?
Aerobic exercises, particularly aerobic exercises. Even
exercises that make it hard for you to make a sentence, like when you're done.
Yes, you have to be panting, you have to breathe. So those are the kind of exercises. Sometimes when we say exercises, the older people say, "I'm not as strong, so I can't really do those things." No, you don't have to be energetic.
Aggressive,
to do. Yes. Something as simple as 20 to 30 minutes walk on most days in a week
it's like 3 to 5 days.
Yes, 3 to 5 days recommended. 20 to 30 minutes of walk for 3 to 5 days is recommended.
That's for the older people. If you are young, run.
Yes, you should go for those runs, and then you'll be good. So we talked about no smoking. We talked about cutting down on alcohol. We talked about reducing fatty foods and diet, not taking extra salts. And then another thing that we didn't mention is that people should eat food rich in potassium, calcium rich in adequate quantities actually. So these are some of the things that would help. I'm not sure I'm missing anyone, Mike.
And that's it for the
modifiable risk factors, and then things people should do. So how about those medications now? When it reaches the point that people have to take medications.
When your lifestyle modification is not forthcoming.
Yes, when the lifestyle modifications are not forthcoming, and by that it means blood pressure is still not controlled, you now have to begin to take some medications. And this is the hard truth. This is the hard pill. The medications are hard pills that people have to swallow. Even as recent as yesterday, I had a patient that for long, she had been failing to accept that she's hyper. She knew when she came and then said, "Ma, you have elevated blood pressure."
God forbid, it's not me.
God forbid, it's not me. Well, she knew that she had that. She said that I don't want to accept it. God will not allow it to happen. So sometimes it's very difficult to navigate this kind of things because we as professionals, we whether we believe in God or not, we believe in God, yes, but some of these things are very important. This I always tell some of my patients that the drug in itself is a miracle. So it is God working through drugs. So just take it.
Because God has given us like the strength and the power to be able to solve some certain problems.
Yeah.
Like you have the willpower to lose weight. You have the willpower to cut down on smoking, to cut down on the drinking and the kind of diets that
Yeah. So and compliance is very, very important for the manager. No matter what the doctor does, if you decide not to take it, then that's you're not. It's not going to work.
Some people feel it's like malaria that you take it for 3 days and then you don't have hypertension again. But if it's a primary hypertension, then it's going to be for lifelong, and then you'll be taking drugs like that. And even if it's secondary, there are some complicated cases that you can't just get rid of, and then you'd have to live with that.
Yeah, exactly. So the summary of it is that when the doctor says you should take it, and then keep on going for follow-up. There are some times that he may reduce the dose, retrieve it for some time, but it should be on the doctor's instructions, not on your own instructions. So, Dr. Oggs, any last words before we round up this?
The heart of the matter, like we've always known since we were kids, prevention is better than cure. As mild as it sounds, it's very, very important, and it goes a very long way. If you don't, there's this saying, if you don't take your food as drugs, one day you take your drugs as food. And for life.
I feel like I should be jotting these things down. All right, guys. So Augsburg has said it all. So I'm just going to admonish, particularly those who would go to the hospital and then you may have to be placed on those medications. Please and please take your medications. Don't stop them. Drugs are not your enemies. They are your friends. They're there to help your life, to make you get better. I'm sure everything will be okay. So this is the end today. Remember to like, comment, and share. Share, guys.
If
Please
you have any
share.
questions,
Always drop
let us
them
know in the comments.
And also tell us something you would like us to talk about. We're always here. Please like and share. Please, we always like to see that people are sharing our stuff. It encourages us that we're doing a good job. Thank you very much.
See you in the next episode.